Assalamualaikum warahmatullahi wabarakatuh. A warm welcome to all of you. Did you all have a good exercise before, prior to joining the session? Hopefully you did. Today is Monday, 4th of December. Just a reminder, in case you've forgotten which day we're on. So today we'll be talking about artificial intelligence utilization for climate-based health forecasting. We know climate and environmental change have many negative impacts in humans' life, and that include expands the geographic distribution of certain diseases and worsen the outbreaks. So adaptive and proactive measures are necessary to plan for effective responses to these impending epidemics. So on this session, we're going to learn the role of AI in developing an efficient and usable system and discover any intervening potential mechanism in disease control to stop the outbreaks before they all happen. So to start with, let me welcome the moderator for the session. He is Professor Hamam Riza from BRIN Indonesia National Research and Innovation Agency. Over to you, Pak Riza. Thank you.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. A very good morning to all of you. It's a pleasure to be here at the Indonesia Pavilion. In these sessions, a very exciting time for all of us. Yesterday, we announced the first health day in the climate change conference, UNFCCC conference. And today will be very delightful to welcome all the panelists. We'll be talking about climate resilience, health forecasting. So first I would like to invite Kelly Willis, Managing Director of Malaria No More, Forecasting Healthy Futures, to the stage. And I also invite Ibu Lasmi Dewanti, Director General of Climate Change, Ministry of Environment and Forestry of Indonesia. And certainly, I would like to invite Dr. Arda Sena Sopahalukan, Deputy for Climatology from the BMKG, the National Agency for Meteorology and Geophysics, Climatology and Geophysics of Republic of Indonesia. I would like also to welcome my good friends from Muhammad bin Zayed University of AI, Dr. Hosni Gedira, the Director of Engagement Services of MBZUAI, and one of our promising talents from KORIKA, Dr. Lia Huliatus Suada. Yeah, she's also coming from statistics schools. Yeah, and we are also welcoming two of our panelists, which coming online, Dr. Imran Pabudi, Director of the Preventions and Control of Communicable Disease, Ministry of Health, Republic of Indonesia, as well as Dr. Kausik Sarkar, the Institute for Health Modeling and Climate Solutions. Please have your seats. Thank you so much for being here. And I would like to start our discussions today. I would like to share all of you about these topics on artificial intelligence. This program, AI-enabled predictive modelings for infectious disease in the context of climate change. So, ladies and gentlemen, AI is rapidly transforming the field of public health and AI-enabled predictive models have the potential to revolutionize the way we prevent and control climate-sensitive infectious disease such as malaria, dengue, and tuberculosis. Climate change is already having a significant impact on the transmissions of infectious disease, communicable disease, and these impacts are expected to worsen in the coming decades. For example, climate change is leading to an increase in the range of malaria transmitting mosquitoes and is creating new conditions that are favorable for the transmission of dengue. AI-enabled predictive modeling can be used to identify areas of high risk outbreaks of climate-sensitive infectious disease, predict the timing, and as well as the locations of the future outbreaks. And we are very fortunate to have these collaborations among all of us, Ministry of Health, Ministry of Environment and Forestry, together with Malaria No More, BMKG, and Muhammad bin Zayed University of AI. I did say all of our stakeholders, right? To works on these predictive models, utilizations of artificial intelligence and many other technologies that are equipped for all of us at this time. Especially, probably all of us are now embracing generative AI. Certainly, all of us are using machine learning and deep learning to gather all the data and then have this predictive modeling. So, without further ado, I would like to invite Kelly Willis, Managing Director on the Strategic Initiative and Lead Forecasting Healthy Futures of Malaria No More. Please provide an overview, Kelly, because we are very much interested to know about these global efforts at the climate health nexus. Please.
Thank you so much, Dr. Hammam. I'm very grateful to have a microphone because I've lost my voice from talking so much this week already. So hopefully you can hear me with the help of the microphone. It's really a privilege to be here in this beautiful Indonesia pavilion. And it has been a privilege and a pleasure to be working with these partners over the last year or so on this exciting initiative. This is really a historic moment where we sit today at this United Nations Climate Change Conference, COP28. As Dr. Hammam just said, yesterday was the first ever health day at a COP. And that is something that Forecasting Healthy Futures, an initiative that I've been leading for the last few years, and many other partners have been working toward for a long time. This is a very long overdue recognition that the climate crisis is a health crisis. And in fact, I've stopped talking about the intersection of climate and health because increasingly we understand them to be one and the same. The way that most of us will experience climate change is through the threats and challenges, pressures to our health and to the health of our communities. So it was really remarkable to see that recognition, and it exceeded all of our expectations at this year's COP. For a long time, the climate change crisis has been almost artificially dehumanized. We don't, a general person out there is more likely to know that polar bears are on the verge of extinction than they are to know that people are dying today as a result of rising temperatures, changing rainfall patterns, extreme weather, all caused by the climate change and global warming phenomenon. So yesterday was a historic moment. In fact, on December 2nd, Dr. Sultan Al-Jaber, the president of COP28, presided over a 2-hour summit in which $1 billion of new funding was announced.
Yes.
Yes.
Yeah.
And
wow.
It was very encouraging. That's not it's sufficient. in terms of the overall climate financing available today, less than 1% of it is directed toward the health sector. But $1 billion was a really good start. And then yesterday as well at the Reaching the Last Mile Forum, Bill Gates and again the UAE announced another $800 million nearly, committed to eliminating neglected and tropical diseases, but in the context of climate change, which we know worsens all of these things. Right. So we need a lot more investment. This is a really encouraging start.
Yes.
And that investment is needed for two things. One, as I said, people are dying today, and we have interventions to help and to save lives today. But secondly, and more importantly, we need to prepare health systems for the challenges ahead. What are those challenges? That's why I'm so excited about what we're doing here right now. A Wellcome Trust, Rockefeller Center, a lot of people who are talking about this describe us as kind of walking into this with both eyes covered. Right. We don't know what to expect. We're in completely uncharted territory. And Indonesia is one of the most vulnerable countries to the effects of climate change, with the second largest coastline in the world, so very vulnerable to rising sea levels, with the presence of infectious diseases, which we know will be complicated and exacerbated in the context of climate change, as well as all of the other human health aspects that will be affected. So I'm so excited about this conversation, this project, because we're really going to answer one of those key questions, which is what to expect in the future as a result of changing climate conditions.
All right, thank you, Kelly. I will have our next round question to you. Just very interesting with all this investment. But now I would like to turn to Ibu Ami, Mrs. Lasmi, the Director General of Environment. Certainly, we are witnessing really a transformative of climate, global climate into global health. So that is really talking about adaptations. So I would like to have some overview of what is the climate change adaptation policy in Indonesia, and what are the priority areas of climate change in Indonesia, Bu Ami.
Thank you, Prof. Hamam. And I'm taking this opportunity also to appreciate and to thank the initiator of the sessions. Indeed, as mentioned by Professor, it is very timely to discuss the relations between climate change and health. After, well, we need 27 COP before we arrive to this point, meaning 27 years. And thankfully that the presidency of COP28 bring the issue of inclusivity and people-centered into the discussions of COP28. For Indonesia, combating the climate change, it's not only a matter of following the global agenda. Indeed, it is a constitutional mandate to provide and to ensure that every citizen of Indonesia able to have a good and healthy environment. So it's, well, whether there is a COP or not COP for Indonesia, doing the things that we are discussing today, it's mandated. So I'm happy to discuss the adaptation issues to this context. Since the beginning, since we ratified the Paris Agreement back in 2016, and we submitted our first ever nationally determined contribution at the time, you may see that our NDC, Indonesia NDC, it's quite different from others. While many other countries focuses their NDCs on the mitigations action, how to reduce the greenhouse gas emissions, but Indonesia, since the beginning of its first NDC, we put adaptation as equal important as mitigations. And following our first NDC, we launched our roadmap, including the climate adaptation roadmap. In our updated NDC back in 2020, we even submit another document, which is long-term strategy for low carbon and climate resilience 2050. And within those documents, the second, the updated NDC, as well as the long-term strategy for low carbon and climate resilience, there are adaptations climate way pathway at the regional level as well at the sectoral levels. Meaning that we are really mean that adaptation is very important. It should be a heart of climate change discussions. Because, well, that is useless to reduce the greenhouse gas emission if there's nobody in the world, right? So that's why it's important. And according to our third national communications back in 2017, Indonesia is expected to experience serious climate change impact, as mentioned by Professor Haman. So since then, we developed so-called data and information systems on vulnerability index of Indonesia. And we are mapping, we made a map of climate hotspot. We have quite numbers of climate hotspot, meaning that numbers, maybe if not all, numbers of points in Indonesia are very vulnerable to climate change. It's not only the waterfront, but many regions in Indonesia, not mentioning all, but it's quite numbers of area in Indonesia, it's very vulnerable. So that's why we invest on adaptations. But unfortunately, adaptations action compared to mitigation action, it's very challenging. It's intangible, and people tend to see the short term, because mitigation, while you install the technology, you can experience and you can measure the reduction. But for adaptation, it takes years, maybe a decade. So there's a challenge. So I believe that adaptations in our policy, it's very important. And you may see in our NDC, in our long-term strategy for low carbon and climate resilience, that Indonesia would like to achieve the adaptations-related target in 3 areas. First, we would like to enhance our resilience in economic and social aspect. Yeah. Second, we would like to build our resilience in life and livelihood. And the third, we would like to enhance our resilience on ecosystems and landscape. Talking about malaria, dengue, we are talking about those 3 resilience aspects: economic and social, life and livelihood, as well as management of landscape and ecosystems. So no doubt for Indonesia, adaptation is at the heart of its climate agenda. And today we are talking about artificial intelligence. I hope I'm enough intelligent to answer
You're very good.
The questions. But artificial intelligence will be very benefit to contribute to the context of Indonesia's climate adaptations target.
Thank you so much, Ibu Ami, Ibu Lasmi, the DG. I will have a question later on. What you have been saying, it's really a global strategy that everyone is now picking up for the nexus of climate and health. So I think it's a good time for all of us to turn to Dr. Imran Pambudi. He is online. Thank you, Pak Imran, for being here. Director of the Prevention of Communicable Disease from the Ministry of Health. So I have some key talking points that I would like you to address. Can you provide us with an overview of the vector-borne disease, especially mosquitoes in Indonesia, and how is the Ministry of Health applying this data-driven decision-making for the control of the climate sensitive infectious disease, right? Such as malaria and dengue. The time is yours,
Yeah.
Pak Imran.
Yeah, thank you, Prof. Hamam. So good morning, everybody. So it's very glad for me to be attend to this occasion. I'm sorry I cannot be there, but yeah, Prof. Hamam, thanks again that you make this opportunity happen to Ministry of Health. So as we are also knew that Indonesia is one of the tropic country. So many communicable disease happen in Indonesia. And nowadays, like Prof. Hamo mentioned, malaria and dengue is still a problem in Indonesia. And both of the disease is a vector-borne disease. And the vector-borne disease is also related with the climate. So Ministry of Health utilize data-driven decision-making by collecting from malaria and dengue surveillance information system and analyzing routine health data that relevant to climate to identify patterns in spreading the disease. And this data is also involved monitoring climate coordinates, factor populations, and disease incidents. And nowadays, the advanced analytic have forecasts for the outbreak, allocate resources efficiently, and implement targeted intervention, contributing to more effective control measures to mitigate and response. So that's my comment, Prof. Hamam.
Thank you, Pak Imran. I hope you will stay throughout this session. We will have some other questions for you to respond to. But let's now invite Dr. Ardasena, the Deputy of Climatology from the BMKG, which is the National Agency for Meteorology, Climatology, and Geophysics. Certainly, you are very busy here at COP28. I heard that you have so many actually activities around here, but certainly I would like to request your points, key talking points. What are the climate services available in BMKG to support the climate change adaptation, just like what the Buami was saying? And how is this relates to the specific focus on the health sector, especially because, climate crisis is now into health crisis, basically.
Yes, thank you very much, Prof. Hamam. And maybe picking up on the good foundation that was just explained by Ibu Ami, that we have a good foundational legislation. And also adding to that, we have a sort of conviction that the impact of climate change is already here.
Right.
And understanding that there is a clear nexus between climate and health. So BMKG has been working on this, exploring about the relation between climate and health since 2017.
Right.
We have a national framework for climate services supporting health activity, involving universities, involving also the last mile actors of the health sectors,
right.
The regional health agencies in provinces. So we have a sort of very inclusive consortium that builds on application for climate and health.
Mm-hmm.
And from that, we pick up one of the urgent matters which was just highlighted by Pak Imran. Also, we focus first on dengue, because that we thought is also not only important, but also low-hanging fruit.
Right.
Because there are a few good universities that has been working about on dengue.
Yeah.
And from that consortium, we have a good now explicit understanding how the climate is influencing dengue.
Yes.
On the long-term side, on the climate change side, we understand that the climate change impact the existence of dengue.
Yes.
So, for instance, this expanding tropical belt of the tropical sectors now influencing areas that in the past they don't have dengue cases or malaria cases like the U.S. for instance.
Right.
Now they have dengue cases. So in that time scale, we see that climate is influencing the existence of these diseases. But on the shorter time scale, on the seasonal time scale, we see that the variability or the number of cases of dengue is very much influenced by season, for instance, and also by La Nina and El Nino. And due to that good understanding that we now have, we have, for instance, these services. We call it as impact-based services for climate.
Right.
Health services, we have dengue early warning in Jakarta, already operational since 2019.
Okay.
And also following that in Bali we have, and also in Bandung.
Okay.
Yeah.
Okay.
That is not only exists as an information, but is actually being used by the actual stakeholders for real field actions. And this is very beneficial, and those kind of activity would like to encourage further. And we are now also working with our key stakeholders also to expand on other diseases like ILI or influenza-like illness, and also respiratory diseases because of pollution, for instance.
Yeah.
And we try to build bit by bit. And we think that data science may also contribute quite significantly in extending and also enhancing this type of services. Yeah.
Okay. All right. Thank you so much, Pak Ardasena. You pick on one of the most important keywords at this time. Is about AI and the data-driven decisions. I might want to come back to Kelly later on, since some of this activity is very much aligned to the campaign program that you have at the Face of Change, right? Just recently launched. But first, I would like to invite Leah from KORIKA, the Collaborative Research and Industrial Innovations in Artificial Intelligence in Indonesia. So, Leah, as you are also one of the data scientists working on this particular collaborations among all of the stakeholders, why is really KORIKA? Why are you here?
Yeah. What is KORIKA?
Yeah, okay.
Yeah, KORIKA is Indonesian Artificial Intelligence Orchestration Organization based on values and pentahelix collaboration. It consists of government, industries, academic, communities, and media. And this KORIKA was founded as a continuation of Indonesian National Strategy on AI. This strategy was written and formulated based on the discussion of a working group, consists of many experts representing government, university, industry, and many more. So the key point here is collaboration. And what is the Indonesian National Strategy on AI? This strategy provides an orientation for national policies, includes area of focus and priority sector for AI to serve as reference for ministries, institutions, regional government, and other stakeholders in implementing AI in Indonesia. So like that. And this is the framework for in Indonesian strategy on AI. So to achieve the vision of Indonesian 2045, we have determined the four focus area, namely the ethic and policy, talent development, infrastructure and data, and also the research and innovation. And we have 5 priority sector, namely healthcare, bureaucratic reform, education and research, food resilience, and also mobility and smart city.
Thank you, Leah. There's really a great overview of KORIKA, and why is KORIKA working on with all these stakeholders is certainly reflected in the vision of Indonesia 2045 towards AI towards Indonesia 2045, the 100 years of Indonesia independence. We'll come back to you later on. I have some relations between the data provided by BMKG, for example, with what KORIKA is doing in developing the data-driven solutions for all the grand challenges, especially in the healthcare. But let's turn to our partners here. It's not partners in crime, okay? This is partners in development, which is the Muhammad bin Zayed University of Artificial Intelligence. And we have here Dr. Hosni Gedira. Some of the initials engagements between KORIKA with Malaria No More, Forecasting Healthy Futures, and also with other stakeholders was initiated by Muhammad bin Zayed University of AI. So I would like to ask my good friend here, please provide an overview of how big data and AI, certainly because you are coming from the academia side of AI, how you react or how you transform, yeah, all this development in data and in AI, in the prediction of planning and prevention of infectious disease, and what is your view of the climate adaptations toward health forecasting? Please,
thank you.
Dr. Rosni.
Thank you, Professor Hammam. It's a great pleasure to be here in the UAE and presenting this great collaboration after like 1 year of work together on this. So to answer your question about the contribution of AI, it's I think it's added value to the existing work. So it will not be replacing the impressive work is being done with the healthcare professionals and 24/7 in the field, but to see how AI community can contribute to help to mitigate this those diseases like malaria and dengue. So I want to add to what Dr. Ardesina mentioned regarding climate and how climate is impacting infectious disease like malaria. So here we're talking about different time scale. If you mentioned El Nino, you mentioned some climate, long-term climate impact, but also here, as part of our joint collaboration, we are looking for a short-term, how we can see weather variation impacting the spread and the outbreaks of those diseases. So what we are doing we are bringing all the expertise from the AI community, from the computer vision, from the machine learning, from big data processing, and see how we can digest all this volume of data to make more informed decision to support people on the ground that working on this. So we are integrating data from different satellite systems, getting data in real time. We are integrating data from different climate model in daily basis. So we are getting like hundreds of gigabytes of data daily, and we try to see how AI can help to predict any trends that we can see, because in the physics, so we know that there's some linkage between weather condition, precipitation, water accumulation, topography, land use, water accumulation, wind speed that is affecting the activity of mosquitoes, how we can integrate all this data and see and see how it can contribute to improve the forecasting. And this is what we are doing for the last year, and we are applying those advanced AI model to understand the causality, to see how the number of outbreaks of malaria in specific location, how it's linked to previous weather condition, precipitation, water accumulation, the temperature in that area. And so far, we have been able to see some correlation that we'll continue working on improving it and to implement a smart system that can help health workers on the ground to tell them, given the observation that has been forecasted now, we expect that there are more cases that might happen and the likelihood of some outbreaks will happen in specific location. So for them, it will be a tool that helps them to prepare, to get ready, and part of the large-scale effort for adaptation or mitigation.
All right, thank you so much. So I think it's really a challenge for all of us, which trying to get the benefit of the latest machine learning and deep learning, deep tech, we can say this, into a lot of usability, the utilization of this technology towards many aspects of our life. So that one is something that we try to implement through a program called Climate Smart Indonesia. So now I would like to turn to Dr. Kaushik, which would be able to actually elaborate on some of the aspect of Climate Smart Indonesia. And certainly Kelly later on will also jump in to introduce this to all of us at this panel. So Dr. Kaushik, please.
Thank you, Dr. Hammam. Honorable Director General Ibu Lakshmi, Pak Ardhasena, Pak Imran, officials from the Government of Indonesia, colleagues and friends. Very good morning. I'm sorry I'm not there in person. So as we heard, Indonesia is taking an exemplary stride in addressing the climate-driven health threats. And a combination of supportive and positive policies that we heard from Ibu Lakshmi and evidence-driven or science-driven practices that we heard from Pak Imran and Pak Ardhasena put a country on the right track of resilience against climate change. Now, circling back to your question, Dr. Hammam, about the initiative, and we can talk about that at stretch, all the partners. But, when we talk about climate change, three issues are really critical from the health perspective. Number one is health security. Number two is universal health coverage. And number three is efficient resource allocation. And climate change affects all the three things. So climate change aggravates more than 2/3 of the infectious diseases that humanity suffers from. And climatologists have been warning us for a long time, and now we have started seeing across the globe that extreme weather events are becoming more frequent. And when these events become more frequent, white-collar strategies essentially become futile, and local capital, local capacity, local preparation matters most at that point of time. And it is this time when all silos are naturally broken and local single human agencies, be it a community health worker or a village leader, are left as the only lifeline for hundreds and thousands for their health, for their survival. And the other part is the resource allocation. So because climate change is making everything so dynamic, especially in the context of resilient public health, we need to think about pivoting to agility and optimizing our response to the ebb and flow of the diseases or the disease patterns that we encounter. So to address these challenges, we started the Climate Smart Indonesia initiative to support the Indonesia government with innovative technologies and partnerships, as well as capacity building. And this innovative technology is not the end of the problem that we are going to face, but it will help us to become more vigilant, proactive, and efficient in our responses in every sphere. And at the same time, we believe in the collaborative efforts that Dr. Leah was highlighting. That was the basis of the foundation of KORIKA as well. And in collaboration with the government, the academia, research institutions, and all the different sectors, it is possible to address the diverse facets of these challenges that we are facing today. And the third piece is that a two-way capacity building where the global community can learn from the contextualized local solutions, and the global best practices in innovations and technology can be transferred seamlessly to countries and integrated to their digital systems. So based on these three principles, we have worked on this particular three-pronged strategic initiative of Climate Smart Indonesia, and we aspire and we are confident to support the government as well as the Indonesian community in their stride to make Indonesia a resilient country in the years to come. So I'll pause here and turn to you, Dr. Hamad.
All right, thank you, Dr. Kausik. Stay tuned, okay? Because I have other question for you coming up later after I got some response here for my next questions to Kelly. Certainly, just like Kausik was mentioning about this climate smart Indonesia, and I think we are here to stay. Not only for we just started in COP28, just like Ibu Ami was saying that it takes 27 years, 27 COP to start being serious about whether the climate, global climate is really affecting, is a threat to the global health, and certainly I really welcome the collaborations from Forecasting Healthy Futures, because we are going to go into the future with some assurance. So the climate smart. So how do you want to go from here, Kelly? Certainly with so many investment that you have mentioned on climate health related project, and how you can see that the campaign program like Face of Change will support further the climate smart Indonesia. Yeah, I think that's really something that I would like to know very much. Yeah.
Yes, Forecasting Healthy Futures launched a campaign recently, a communications campaign called The Face of Change, which is really meant to, really spread the message that, make health the human face of climate change, and to really make this connection between climate change and health visceral and integrated in people's understanding, and get that word out beyond the experts in the health and climate communities who've been discussing this for a long time, out into the general population and civil society and grassroots organizations, because that's all going to be really critical. And I think the way that bubbles up to help Climate Smart Indonesia is that you are going to need that broad collaboration between multiple sectors, and communities play a very large role in this. So understanding that connection and having that buy-in from communities is going to be really critical. So we've been talking about, in Indonesia in particular, the effects of climate change on health are broad. Every aspect of health is affected by rising temperatures. I always say it's everything from asthma to Zika.
Yes,
and everything
A to
in
Z,
between, right? A to Z, right. But right now we're talking mostly about climate-sensitive infectious disease, and we've heard how climate conditions affect the range, the seasonality, the extent of the transmission of diseases like malaria and dengue in particular. And then we've heard how data, beyond just the climate data, but coming from lots of different sources.
Sure.
As Dr. Hosni said, human mobility, transportation routes, soil and land use factors, things we can see from satellite about, Earth observation data. And then a whole bunch of private sector data too, combining to be this wealth of data that, combined with the capacity of machine learning, artificial intelligence, can be highly useful in predicting when and where those diseases will be transmitted.
Right.
And that knowledge, that foundation of knowledge and predictive capacity, yes, we need to know long-term where things are headed, but that short-term prediction, 2 to 4 to 6 weeks, gives the system time to respond and prevent those outbreaks in a lot of instances.
Yeah.
And what I always say is that if there is a silver lining to these new challenges that we're facing, the pressures that rising temperature, changing seasonality and rainfall patterns is putting on infectious disease transmission, it's that in building these systems to understand that better, we are going to become more efficient at using scarce resources to combat these diseases. And I'm actually optimistic that with this anticipatory knowledge, we can have what I call precision programming. And every dollar will go a lot further in preventing these diseases so that we can really still aspire to eliminate malaria and dengue in Indonesia in the not too distant future with this, climate smart Indonesia. And combined with, the broad community buy-in and the multiple sector partnerships, which are so critical. I mean, multi-sector initiatives have always been critical for our global health, but never more than now in the context of climate change. And so I'm so encouraged by the leadership that Indonesia is demonstrating with these really encouraging and productive, constructive, cross-sectoral collaboration. It's something that is rare. I was just having a conversation last night with the head of climate and health at the World Health Organization, who's saying how few countries she's actually seen that kind of collaboration across sectors work. It's hard because there are not aligned incentives necessarily. There are data sharing barriers. There are, siloed programs. And so showing that leadership from the top and that willingness to collaborate and share data across sectors is a success factor and makes me think that Indonesia is going to be on the very leading edge of demonstrating how climate and health can be addressed by multi-sectoral, data-informed, AI-enabled systems.
Right.
Super, super encouraging. I'm really privileged to be part of it.
All right, thank you. Thank you so much, Kelly. It was really, a big motivation to move on for us for the issues on climate and health. And you mentioned about the leadership, so I have here Ibu Ami, which I am very fortunate to know her, and was trying to explain to her in the first place about why KORIKA is coming to Indonesia Pavilion to have these talk shows on AI utilization for the climate health, climate resilience health applications and tools. So, Buami, hopefully we will continue, and you will also continue to support the discussions and the collaboration, just like Kelly was mentioning, on all the stakeholders to bring in some of the most promising developments of using AI, data-driven tools into the perspective of climate adaptations. And how do you see this going forward for the Ministry of Environment and Forestry, especially in your Director General?
Yeah, indeed. As I mentioned before, that it is very timely to have these discussions.
Yes.
Because for Indonesia itself, it is a time to accelerate our nationally determined contribution. We are now preparing our second NDC and hope to submit our second NDC by next year. And within the second NDC, we are
What
not.
is the first one, Bu?
Well, we already have 3 NDCs, by the way.
Oh, okay, 3 NDCs
The first
already.
NDC was nationally determined contribution.
Determined contributions.
At the moment, we are at the enhanced NDC, which is we already enhanced our target
Right.
for both mitigation and adaptations. And now we are preparing for the second NDC. The second NDC meaning that the second NDC will be the NDC that very much align with 1.5 degrees Celsius scenario. You know that globally, we would like to prevent or to ensure that the rise of the global temperature no more or no higher than 1.5 degrees Celsius.
Yes, that's right.
Even 1 degree Celsius for malaria and dengue, it's already break up. So we have to work on it. And I also mentioned that we have the data and information system on the climate vulnerability. Dr. Adarsena mentioned that BMKG have also another system. I'm sure that another parties, another stakeholders have their own data and information and some of intelligent and innovative action. So it is a really matter connecting the dots. So I believe that AI in this context will able to assist us or to accelerate us in finding those dots and connecting those dots. Because actually we cannot work alone. So we need kind of innovative technology including the AI to expedite our innovation, to expedite our transformative solution to climate action.
Very good.
So there is no doubt that Indonesia will consider this initiative as one of the important. It's very much along with the UNFCCC, you know, under the mechanism, technology mechanism, AI, it's already regarded as one of the most promising
Right.
innovative technology that will contribute us in our journey toward just transition of the climate change.
Wow, wonderful, awesome. Thank you, Bu Ami. So we are going to, accelerate the use of this technology. The technology, certainly, Kelly was mentioning about A to Z, about this climate health, and we also from the technology sector is going to implement A to Z. A for AI, B for blockchain, C for cloud, all the way to Z, which is the zero knowledge proof, okay, which is the digital identity. So, and we want to actually address most of the CSID, the climate sensitive infectious disease, as well as the neglected tropical disease, NTDs, right? I think Dr. Tedros, head of WHO, mentioned during the Reaching the Last Mile event yesterday that, a lot of NTDs needs to be addressed, and how we can develop tools to address the issues on these NTDs. And I think it's really timely for Dr. Imran from Ministry of Health. I'm seeing that you need to be at the COP next year, Pak Imran, because the urgency of the climate and health issues and the adaptation that Ibu Ami was mentioning, as well as other speakers here. So I have a question for you in this next round. So how do you see that all this available technology will impact the health security, especially when climate change is expected to increase the risk of the vector-borne disease and other, related disease? Pak Imran?
Yeah. So the performance, so the artificial intelligence can also enhance the security in the face of climate change and increase the risk of vector-borne disease by the early detection, predictive analytics, vector control, diagnostic support, epidemiological surveillance. So artificial intelligence tools can process vast amount of health data to track and analyze disease spread, supporting public health agencies in monitoring and responding to emergency threats. So I think, in summary, artificial intelligence offers a data-driven approach to enhance preparedness, response, and overall health security in the context of climate change and the increased risk of vector-borne disease. So that's my comment.
Okay, so that means that we are going to accelerate our cooperation. Recently, just to announce that this very wonderful opportunity to announce that we have signed the MOU with the Ministry of Health recently, and you are going to work, all the possibility of having the climate-sensitive infectious disease to be part of and expanding the collaboration that we have. And certainly, we want to also collaborate with BMKG to actually expand what they have achieved so far, and make all this disease being driven by the data insight, the data science, and we all can have very integrated climate health forecasting tools in the futures, in the near futures. So how do you respond to that, Pak Arda Sena?
Can I have my slide, please? Yeah, I think the promise of using data is very good, but if I am allowed to perhaps to encourage a few approaches to enrich this data approaches.
Yes, please.
Can I have my slide, please? First of all to encourage the establishment of health data framework.
Right.
That is perhaps complementary or fit with the framework of the meteorological data and as well as the climate data. That data framework, meaning that the data is quality assured, it is collected in a consistent way and also in standardized way, and that will enable this very nice application maybe to be better accelerated. So we have to ensure the consistency, the standardized way that this health data is being recorded cases, because in our experience from 2017 on working in this climate and health application, the practice, I would say, from the cases that we are working on is not yet consistent. But there is an opportunity there, I think, to learn from best practices worldwide, but also in Indonesia. For instance, the case in Jakarta is very good. Right. That can be extended and also can be replicated to other areas. And also, I would say that not only data approach, but also still mixed with the phenomenological approach from the health side. I think this mixed combination is very good, and also I think it's a key factor that will extend and enhance further this application. In
tools in order for us to adapt to the climate health, services. So. Picking at that point, of having this data driven for the climate health services, how do you see that we can, with our imagination and innovations, to be creative in this climate health? Certainly, Dr. Imran from the Ministry of Health probably have some of the things that they want to integrate into the Satu Sehat, which is One Health, the new architecture. And I think I need to jump to Dr. Kausik, because I had discussed this about how we can, really be successful in adopting this technology, and how we can embark in a journey where our new health architecture because of the recent COVID-19 pandemic, right? Uh, it reminds me that we need to work together in order for us to be stronger and to be collaborating in all aspects of our climate health issues. So, Dr. Kausik, can you jump in to respond to that? And some of our discussion earlier is really mind-blowing, I would say, but it's a challenge actually. It's not easy. It's not like we talk about today and try to implement, and tomorrow we will have these tools because of the availability. Just like Dr. Adasena was saying, the data is the point where we want to embark in this journey. Yeah. So, Dr. Kausik, please.
So I completely agree with Ibu Lakshmi and Dr. Arthasena. Ibu Lakshmi called for connecting the dots and unlocking the resources of the gold mine, that's the real world data from diverse sources. And Dr. Arthasena put into the frame the integrated framework where you need to integrate health and non-health data. It's not just only climate data, you need other data as well to adequately respond to the challenges that we are facing. And this is absolutely possible. Humans made machines to reduce efforts and do more work in less time. And with machine learning and AI tools like this, we can ensure that the work that we do creates the most impact with the least cost, especially when our health systems are challenged with crises like climate change. And predictive tools, first of all, powered by AI, functions like a crystal ball. It is always giving us an extra edge, which Kelly was talking about, because of the extra lead time that we get to prepare. So it not only tells us about where the hotspots of a particular disease are, it also helps us anticipating outbreaks or epidemics. Simply speaking, with tools like this, we can be more vigilant, converting our suspicion to a strong surveillance, and we can prepare our public health arsenal, be it medicine, vaccine, insecticide, long before a crisis hits. In an archipelago like Indonesia, where the east is affected, let's say, by malaria, while the west is affected by dengue, and the distribution of diseases, especially the climate-sensitive diseases, are so diverse, this also means preventing the transfer of diseases from one island to the other with the use of mobility information that you can see in the system that is in the pavilion. And the other part is that extreme weather events, which I was talking about, forget about universal, even maintaining basic health coverage during the time of flood, cyclone, or hazards like that is a monumental task. The only way we can help the local government and the local communities and the human health agencies in this situation is by providing timely warning about the extreme weather event and preparing the front line with necessary health supplies and services well in time. And finally, talking about resources, a few years back I had the privilege to work on a review with the Gates Foundation and Ministry of Health to inform oral cholera vaccination policies. And we found how challenging reactive vaccination can be because the stockpiles are limited, upsurges of cases are uncertain. So this is true not just for oral cholera vaccine, for all tools like dengue, typhoid, and chickenpox vaccine, chemoprophylaxis
Right.
to prevent disease spillover, and all others which cannot be procured or programmatized under routine public health programs, we can make efficient planning and resource pooling. So that's how it is basically what I call an integration of public, precision public health, early warning, both
Right.
climate and disease early warning into one single unified system to support everything.
Just like the dashboard here. So maybe it's good that we invite Dr. Hosni to actually, uh, present for a few minutes about what is going on in here in central Papua, for example, that we are showing here. So this is a system that probably we all here are interested to know more about this, all right?
Yeah, so this is the result of our joint work with the KORIKA, Mohammed bin Zayed University, Malaria No More team as well, with in the integration of different sources, different data sources that we provided to have this digital twin, as I mentioned earlier, to help like decision maker to forecast and to get ready for any outbreak that is linked to weather and short-term weather forecast. So this tool is showing different data entry, and one of them is real-time satellite data. I think Dr. Imrani joined us from Jakarta, so he can check the window and see if it's raining in Jakarta or not, but you can see the real-time information.
This is live data.
This live data that is getting each update is 10 minutes, giving information about cloud coverage, about precipitation, also about humidity and temperature that we find out that are somehow correlated to future activity of malaria or mosquitoes. So as Dr. Imran mentioned, is about vector control, how you can use short-term weather forecasts for vector control and help people on the ground for take action. So we have the weather data, and also the large window in the middle, it shows a real-time illustration of different sites that we are studying now in central Papua and Lampung. And this is, by the way, it's a real-time illustration of the weather condition at that location. So if it's precipitating, we can see the precipitation. If it's raining, if it's like windy, if it's cloudy, if it's clear sky. So this is also helpful to direct any help on the ground as well. Other important information that we integrated our decision making process is the mobility data. I think Kelly highlighted this earlier about how you can integrate schedule of flights from two main infected areas in Lampung and Papua, and see to have an estimation about exported cases to other cities. And this is by integrating real-time information about the airliners, traffics, and also the maritime traffics between those major cities to all over Indonesia. And this is also will be used for healthcare workers to be ready, to get ready as well if there is any larger outbreaks in specific cities, how those can be exported and will be exported. So this is quick overview. Also, this same dashboard is illustrated at the entrance of the pavilion, so you can have more modules or more functionality as well.
Thank you. Wow, wonderful. So we are going to expand this. All of the participants here, you might, on your way out, you can also witness the dashboard outside with the whole informations provided with some forecasting of the malaria cases. And we want to, as I said earlier, we want to expand this to other diseases, especially the climate-sensitive diseases. And we are working quite hard in terms of providing this data, the real-time data, the historical data, the time series, which is all is necessary to have really a good predictive modeling. And I want Leah to jump in and try to describe the work that KORIKA have been doing in providing the data to Mohammed bin Zayed University of AI, so that we have this really wonderful system with us at this time. Yes.
Thank you very much, Prof. Hamam, for the question. So, yeah, the challenge to create such a really wonderful dashboard is data collection. So we need the data from various sources, and of course, this data cannot be collected without the collaboration between many stakeholders here. And yeah, this KORIKA help to accelerating the implementation of AI by collaboration between many stakeholders.
Okay. So currently we are getting this data from the perspective of weather, the climate, and also from the malaria system which is available at the Ministry of Health. And certainly we want to have some more data also from the Ministry of Environment, especially in terms of the climate change, which will also expand the system furthermore. So I think this is something that we all want to work together. And as Kelly have said earlier, that a lot of attentions are being put into this work, and we try to collaborate even further. So perhaps I would like to invite Bapak Ibu, all the ladies and gentlemen with us today at these sessions at the Indonesia Pavilion. If you have any question, I have the opportunity to open the question to the floor. If you have any question, please raise your hand and please state your name and where you are coming from, and we will be happy to address your questions. Really, yes.
No, thank you very much for this very informative and cutting-edge work that is being done.
Yes.
And
sorry, sorry,
yeah.
sir.
And my name is Mihir Bhatt,
okay.
and
Mr.
I
Mihir.
work in India with All
India.
India Disaster Mitigation Institute.
Right.
And I've had a great pleasure to work in Indonesia after the tsunami,
Okay.
mainly Aceh, but also far beyond that.
Yeah.
So the progress that Indonesia has made in integrating disaster risk and climate risk, especially in the health area, is remarkable. So I want to congratulate on that. And this is not only progress, but is actually on the frontier of what is being done globally. So again, congratulations on that. I missed one of the sessions. I had a call, but by and large, all the presentations, I had the same question and anybody could ask.
Sure.
And that is that what happens to the data that goes in for AI to generate the results in terms of the ownership of the data? Is it public ownership? Is it private? Is it in the commons? Is it one? And therefore the sub-question to that is that how do you build capacity of all the stakeholders, including those who are affected by the climate change, to have access to data and ownership of the data?
Yeah.
Thank you.
Yeah. Well, thank you for very important questions, because a lot of us are really curious about how you make this data available, right, to the system. Just mentioned by Leah that we did the data collection, and I think that is one of the, it can give you a big opportunity, but also it's a big challenge, especially if this data coming from the ministry, whether it is public data, whether we do the aggregation of this data, or is it private? Are we taking the data and keep it, or are we just borrowing the data? I will, distribute these questions, the answer to all of the panelists actually to respond to that. But let me start with Dr. Hosti. Yes.
I think this question is more for Dr. Leah, because she's the one that we are putting a lot of pressure on her, because it's our focal point through KORIKA team to collect data from different stakeholders. But you're right, this question is very, very sensitive question, because data ownership is especially in the healthcare data is, each country is protective, and we understand this. But our approach is all the developed tool will be deployed at KORIKA in Indonesia, so the data physically will be based there.
Yes,
so
yes.
So the data, we have different input of data. So the malaria data is used to train the system, develop the machine learning algorithm to be able to predict cases based on weather data. So this is used for the training, but later on, we use the data only for validation of our algorithms.
Yeah.
We have a different, we have a second aspect of our research in the microscopy as well. It's not presented here, but we are collecting microscopy data and see how we can use AI and advanced computer vision technology to improve detection, classification of malaria cases based on electronic microscopy. Maybe Leah
Yeah.
can have more.
Please add to that question.
Okay, thank you very much for the
Answer.
question. Yeah, so we have a lot of data here, the various of data coming from the various sources. For example, the data about the malaria cases, of course, from the Ministry of Health. And it's not the public data, of course, it's from the Ministry of Health. And we have the agreement about the data, so we just consume the data and build the prediction. And then the other data like the population and also the mobility is come from the BPS Statistic Indonesia. We can access them from the website, and also the weather coming from the BMKG. We can also access the data from their website. Yeah, actually the data that have the ownership in the ministry, we can keep it private. In that case, and the data coming from public, of course, we can also get freely from the website and other. Like,
Right.
Thank you.
So there is some non-disclosure agreement for getting this privately data, but most of the data is public data, which is being published by the ministry and related agencies. So that should be, we are in the stage where we actually, for an AI system, we just need to borrow the data, and it is sitting right on the premise of each ministry and agencies. So there is no action of getting this data, copying this data, and then putting it in some other places. And this should be getting the data governance that we need to have in working up our predictive modelings and many other forecasting system that we want to do. And I think that is shared by Malaria No More and many others organizations in order to do this. Do you want to add to that, Kelly?
No, I think we touched on the critical points there. Primarily, these systems hopefully rely first and foremost on publicly available data, so the ownership issue isn't as critical. The healthcare data is where we have traditional challenges, right. And and I love what you just said, Dr. Hammam, about we're borrowing the data and leaving it there.
Right.
So training the systems using the data and validating, but not exporting the data, not using the data for other purposes. So I think I'm confident that most of the issues can be addressed that way. But that is one of the sort of most familiar challenges in working across sectors too.
Sure.
So it's important that we're talking about these issues and hopefully can get better at formalizing, documenting best practices and be able to share that with other countries so that not become a barrier to creating these multi-sectoral predictive models, because that's the key. Right. This is really this enormous asset that we are, Dr. Kaushik said, to realize the enormous capacity of this big data and the predictive knowledge that it can provide to make intelligent health systems. So, great.
Thank you. Yeah. Just a quick one point for you, Ardasena, on this data.
Yeah, we are certainly in a position to support all weather and climate data are in principle is public good.
Yeah.
So as well as the forecast data, historical data is as well. So
all right, thank you. I think likewise for Dr. Imran here, the health data is provided by Ministry of Health. Is certainly a public data that can be used, and it is part of the malaria system that is Dr. Imran was organizing and governing this data toward the use of. We have just has,
Fine.
0 minutes actually. So I would like to have this few seconds to give you the concluding thoughts on these sessions. The impacts of climate change on the climate-sensitive infectious disease are a serious threat to the global health, and we need to take urgent action to address this challenge. We need to develop and implement effective strategies to prevent and control CSIDs, the climate-sensitive infectious disease, and the neglected tropical disease, the communicable disease, and we need to build a resilient health system that are capable of responding to the impacts of climate change. So with that, I would like to thank all the panelists here, Ibu Ami from the Ministry of Environment, Kelly from Malaria No More, Dr. Hosni from Muhammad bin Zayed University, Dr. Adasena from BMKG, Leah all appearing at the Indonesia Pavilion, and certainly all our partners joining us online, Dr. Imran Pambudi from Ministry of Health, Republic of Indonesia, as well as Dr. Kausik Sakar, one of the initiator of the Climate Smart Indonesia. With that, I thank you, all of you, ladies and gentlemen. Wabillahi taufiq wal hidayah. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam. Thank you very much.
Thank you so much.
Pak Riza, and to all the speakers.